face the jail time. Now, if anything that's worrying after 5 years of COVID-19 infection that was in fact the origin from China, it is the similar COVID-19 scare that is now being reported from across the videos and pictures on social media. The surge in infections is caused by human metapneumonia virus, which is normally known as HMPV, which has been reported in China, as the administration has stepped up screening, detection and isolation protocols to deal with the unknown pathogens. Fresh videos on social media show the hospitals and crematoriums being overburdened by large crowds of masked people. HMPV cases are reportedly rising, especially among those under 14 in the northern provinces. This mysterious respiratory virus is reportedly spreading like COVID-19 through touch and contact with the contaminated objects. Common symptoms include cough, fever, nasal congestion, sore throats and shortness of breath. Meanwhile, according to the Center for Disease Control and Prevention, severe cases can lead to pneumonia, bronchitis and white lung syndrome. The question is, should India be concerned, and if, how much India should be worried, given in fact the ramifications that India and the world at large has faced 5 years back? All right, Dr. PSV Rao, who is the healthcare expert and surgeon, is joining me live on the broadcast to in fact declutter the complete rumors and also declutter the information that's flowing in at this point of time, given how scary does this sound now coming as per the reports from China. Mr. Rao, appreciate you joining me live on the broadcast and thank you for speaking to NewsX. You know what actually we should be looking at this given point of time is the measures that India is taking. But as we have also spoken yesterday, and I want to begin it from where we have left, how exactly do you think on everyday basis there should be preparations that the Indian administration, in complete consideration with the healthcare officials, should be making to ensure that the transmission at least remains minimal or negligible, so that we can be prepared better?
Good morning to you and all the viewers. Yes, the real problem is the opacity of the Chinese government, which means we really don't know what is going on there. So we have to prepare for the worst. We shouldn't get worried, but we should need to be very concerned about it. And the measures that you are asking that can be taken, one is that we use whatever channels are available to us to try and find out what exactly is the viral outbreak. Is it a general outbreak of multiple viruses, or is it a specific virus causing the problem? This could include foreign journalists there or anyone else who is willing to actually tell us what is happening, because we can't depend on the Chinese government going by their past. Second, we have to get the measures ready like we had for pandemic, have quarantine systems in place, have health checkups going on for people coming from China, either directly or indirectly through other nations. Like we had this problem last time, we blocked the Chinese flights, but the virus came through various other nations to us. So these second measure. Third measure is the moment we can figure out what virus it is, and if we can get our hands on the new variant, then our vaccine suppliers and providers have to be updated with this genetic sequence of that virus, so that they can update whatever viruses are available, whatever vaccines are available for influenza virus and for coronavirus, if it is one of them. And as far as the other two viruses that have been named, they have not, we don't have any vaccine anywhere on those viruses, but they are known to cause only mild pneumonia and respiratory problems. But it may be a new variant which may be far more deadly than the older ones. So we have to get all the usual preventive measures in place. at the airports, at all points of entry, plus in the hospitals, where we should have the hospital authorities ready in case there is an outbreak to have to be ready with various quarantine measures.
Mr. Rao, as I understand that in fact the Indian Health Ministry is also keeping a close eye on the movements and the developments that we are tracking from China, given of course in consideration how it spread like 5 years ago. But the Indian Ministry has said, cleared the air on this and said it is not that worrisome. So the question remains intact. How worried should we be now? Because at the same time, when COVID-19 started to in fact transmit into India, the Indian Ministry in fact also said the same thing back 5 years ago. It does not need to be worried for a long time. But then we all saw how it began and transmitted further.
This is what I said earlier. We will now have to use non-governmental sources to try and find out what exactly is going on there. If the Chinese government is not going to tell us, then we will have to use whatever other sources we have.
Hello?
And that includes what basically that we can do at our hand.
Yes. And we should encourage people to start using N95 masks and take all precautionary measures, including hygienic, taking various hygiene, various hygienic processes like cleaning our hands and keeping, avoiding unnecessary crowding and unnecessary touching of various door handles and other such public.
In that regard, is it also suggested in hindsight that the travel restrictions should also be put in and come earlier before in fact it gets too late?
But we should stay alert and be ready to introduce it if required.
All right. Dr. PSV Rao, thank you for in fact speaking to us and giving us your time on this very important issue that we are putting in perspective at this point of time. It's time to shift our focus from there to what in